Medicare, 8 million seniors last year saved $1,500 on drug costs. Why? Remember the infamous donut hole? Where Medicare D, you have to pay, you get copay, you share the cost up to a certain amount, and then you pay the whole donut hole, about $3,000 out of your own pocket. That's halfway closed and will be closed in the next 2 years. $1,500 seniors got back, 8 million of them. Healthcare cost.
Ask who knows somebody that participated in that. Somebody here that knows somebody.
I don't know if there's 8 million across America. Are you one?
I know people
that do know it.
Yeah.
And so there's an example here. We also have, understand, healthcare costs used to rise 6% every year for the 10 years prior to the Affordable Care Act being passed. The last 4 years, in the first couple of years, it was only partly due to the Affordable Care Act, but it's continued, it's risen at 3%. We've cut healthcare costs in half. In fact, because of the increased competition in the individualized market, where there are rules that they have to meet, that toothpaste or that healthcare plan has to meet certain requirements to be able to put it on there. What it means is that we have saved $100 billion, less than was predicted for the Affordable Care Act. And it was all paid for. We didn't increase the debt, and it was all paid for. These are other issues over here that I could go through. And I'm happy to take any other questions as we continue through. But there's several points I want to bring up about what still needs to be done. Because right now the premiums on the healthcare exchange, whether it's gold, platinum, whatever it is, those 4 levels, are less on average than employer-based premiums, which in the decade of 2000-2010, when the Affordable Care Act went into effect, like if you work at Acme, who works at Acme? Somebody here does. He left, all right? His premiums are going up. The employer-based premiums are, on average, for those 4, higher than they are for the Affordable Care Act's individualized exchange because of the increased competition with more people in it. Last points, and then I'd like to open up the questions, is there are several things that need to be redone. If you go up to Maine, they permit the reimportation of drugs, of pharmaceuticals made in the United States that, or they're in Canada, made under the same requirements of the FDA to be imported into Maine. You can cross the border, you can buy them and bring them back. It saves upwards of 40% on here. Number 2, as a vet, if I was in the VA actually can negotiate best prices with pharmaceutical firms. Medicaid can do that. Medicare, which is the biggest buyer of drugs in America, cannot. Under a 2003 law, I think it was 2003, it might have been 2002, Medicare is now forbidden to negotiate for best prices. So the same drug that the VA gets, at usually 40 to 60% less, Medicare has to pay a lot more. Now mind you, if you're a private company under Medicare Advantage, providing Medicare is a private company, they got a loophole. They can negotiate best prices. We tried to change that in the healthcare law, but it got taken out in the Senate. And then doing away with paid for delay. About $3.5 billion more are spent on drugs and pharmaceuticals by people in America because generics cannot or are bought off by brand names. So if you've got that Lipitor, if I say that right, that's about to go out there, the person who has the patent, that company will buy off the generic one that's about to go to market. Then they don't do any work, they get a lot of money, and you can continue the patent forever. For the time of the agreement. Those kinds of things where the common weal, everyone suffers because of a monopoly, has to be changed. Those are the kinds of issues that I still want us to see addressed. I would love to get to the United States Senate and be on the Health and Education, Labor, and Pension Committee, which has so much to do with our working families, healthcare, education, labor, working families, pensions, and all of it. I will stop. I merely wanted to go over that. I love those town halls with the Tea Party. I love them. I just would go there half an hour before it started, and I would shake everyone's hand as they walked in. And they would yell and they would scream, but after my last town hall, 2 weeks before the election, the Delaware County Tea Patriots asked for a photograph. My belief is we can be disagreeable in a democracy. We don't have to be divisive. My belief is I owed it to be out there to explain and to talk to people. I have yet to see Senator Toomey hold a town hall that's open to the public. Except in Potter County, a second month with guards were there waiting for people to try to egress in. Everyone is by invite only. If you notice, we just put ours out and let people come. We even put it on websites. I will stop and say this. I'm interested in your comments. I'm interested in what I still need to know. But I will promise you this. I will continue to walk in your shoes every day in Washington, D.C. I did it as a captain of a ship, even as an admiral. When the last flights came home from Iraq or Afghanistan, at 2 a.m. in the morning, I'd go down to mess decks and sit and chop. I wanted to calm down because the troops were home, but I also just wanted to listen so I could do my job better. I'll stop right there. Questions, please. Go ahead.
I have a couple. First, are you at all concerned with the merger of some of these huge private insurance companies and what that's going to do to prices and costs and whatever?
Yes, because we had in the Affordable Care Act, when it left the House of Representatives, the removal of the 1948 law that permits, that lets a waiver for antitrust behavior be given to the insurance companies. That's why here in Pennsylvania, Blue Cross and Blue Shield have 80% of all policies. They're allowed to collude. The only industry in America that's allowed to collude. And so the more that they merge, the more concern I have, because 94%, according to the Antitrust Division of the Justice Department, 94% of all healthy markets in America, before the Affordable Care market happened, were non-competitive because of this 1948 law. The Senate took it out. The point, though, is why I think eventually you'll see insurance companies go away is because of the individualized exchange. I was speaking with you to this as we were walking. That individualized exchange, two things. Individuals can get into it, but also we have one called SHOP for small businesses like this. Their premiums are 4% less than if this restaurant went out to provide health care out on its own on the regular exchange. But here's what happens in 2018. All companies, including Acme or anyone else, is permitted to put their individuals into the exchange. All of a sudden you bypass the insurance companies. Because what's also happening, I mean, the insurance companies are offering the wares, but if you've noticed what's happening in Pittsburgh and other places, are providers, the hospitals, and the doctors' organization, the Affordable Care organizations are beginning to offer almost their own insurance. I think what you're going to see happen here, my concerns, yes. Do I believe that this works out as some envisioned it, that you have this individualized markets available for everyone, greater choice? You can switch every year if you don't like it. There's minimum standards. Competition creates lower pricing. And eventually, what do the insurance companies do that the hospitals and providers can't do themselves? That, to me, is where I'd like to see this end up.
And one other concern I have is, I believe it's according to the Congressional Budget Office, that there's still, at the beginning of the Affordable Care Act implementation, there were about 50 million Americans without health insurance. There are still about 35 million uninsured. What movement?
Okay, here's where the exact statistics are, and I do them by percentages. 20% of Americans had no insurance when this began. We are now, according to what came out about 2 weeks ago, about 11.7%. we've cut it almost in half. She's absolutely right. What we do is have to get out there and make sure that more and more get on it. That's the same thing with S-chip. It's the same thing with Medicaid, even before this. At times, people just don't get out and sign up. But that's part of the reason why we had a slight penalty if they don't. That's supposed to go into effect. Why? Because if that young man walking down that street gets on a motorcycle, well, he's not that young, but gets on a motorcycle and goes in the emergency room without health insurance, who pays for it?
We do.
We do.
You got it. So when I go to Elk County and I talk to them about health care, you know, I say to them, do you like freeloaders? Or if I go to another county, or even here, say, do you like freeloaders? Heck no. Well, guess what? Those who don't have health insurance get in an accident, or if they get sick and go to the emergency room, you pay for it, on about $1,500 a year. Because the emergency room, the hospital passes it on and negotiates with the insurance company, who then, when it gives you a pricing, adds it on at about $1,500 a year. So my take is big progress. Actually, more quickly than the CBO predicted, down to 11.27%, about 12ish, let's say. But more needs to be done. Why? More people in it, more competition, and the premiums go down because more healthy people get in, etc. So that's why we want to do it. Yes.
I don't understand why the law monitors what we call Cadillac plans. I work in a union environment. We had great, we had the Teamsters healthcare. Our employer was going to get penalized for that kind of plan that we had. We didn't pay nothing. We paid $15 a week out of the pay. The Teamsters paid everything. I'm telling you, we had no deductibles, no nothing. Probably the best plan in Pennsylvania I've ever seen in my life. And they were going to get nailed with penalties for having that kind of plan. I didn't understand. I wonder if you could explain why.
Yeah, the thinking on it was, let's give them a period of time to transition, okay, which I think is 2018, correct, as I remember?
I thought, yeah.
2020 or 2018
Yeah,
or
I
something.
think it's 2018.
And the reason is, although the company gave you that Cadillac plan, we paid for it, because they wrote it off on their taxes. And so what it was is, look, you get, not to give, you know, in other words, do they get the right to a gym to work out? It's a good idea because it helps you be healthier. But they can write that off in their healthcare plan as a tax deduction. So the concept was, is it fair to the commonwealth? Particularly now that we're transitioning to a whole new way where you all can then, 2018, by ACME and others, be put into the individualized exchange. So the concept was, that's okay, but it needs, should everybody be paying for that? Should they, let's have them still do it, but maybe they don't write it off as taxes because we pay for it. And that's the concept. Now, one other thing, if I could. Well, you were going to ask something.
Well, I was just going to say, wouldn't it be better is that penalizing the working man? Wouldn't it be better instead of going after the healthcare then, is restructuring the tax code that the companies could sit there and deduct that kind of, that was all through negotiations. That was part of our wage packet that for our insurance, that's included in one umbrella. That's based off our hourly wage, not just our hourly wage, but our pension, our healthcare.
I agree with you.
Umbrella.
The right way to do it is to accept it what John McCain had. You know what I mean? Which was his proposal is it's like a corporate tax loophole overseas, okay? The final outcome of this was worked over, unfortunately, in the Senate. But I think the right way was, look, we just want to be fair in all this. And by the way, we wanted to be fair because you got that through negotiations.
Right.
All right? So it's not right all of a sudden to pull the rug out from under you, which is why a period of transition was given, but also why we said in 2018, you have the choice of going into the individualized exchange with that company.
See, I learned something. I didn't know that. I didn't know they were writing that money off.
Yeah. I mean, there was
I really didn't. I learned something in it.
So this bill, people critique it as being thick. Every bill in the Senate is thick. And when we launch an aircraft strike over Iraq, the briefings, if you add them up beforehand, are about that thick. My daughter, when she goes through one brain operations, if you put all the text medical journals together of how to do that brain operation and the nurses and all, it's probably that thick. So was it thick? Yeah. Because of all the different populations that were gonna be affected. And we tried to be fair on that on the whole.
No, I understand it now, I really didn't know that part of it, I didn't know they were allowed to.
Question, yes, sir.
One of the statistics I think, you know, you can use, you said you like to talk with the, you know, the Tea Party folks, and we do have a lot of people in this state who are really big on saving money and efficiency and small government and so on, but one of the statistics I saw that amazed me is that because our healthcare system is so overpriced and messed up, that we actually do spend already the same percentage of GNP from our government on healthcare that, say, a European country does, except the difference is that for us, that only covers maybe a third of our people that are on direct government healthcare, and in Europe it covers everybody. And we spend that same percentage again on the private sector. So I think you can make the argument that, you know, even going to single payer would save the country an immense amount of money. And if you're looking to do, you know, healthcare efficiently, something like that is the way to do it.
You're not wrong in this argument, but there's the art of the doable. Right. That has to be considered. Also, when you look at other countries like Germany, they're really not all single payer. There's a hybrid, you know, where they use private insurance companies to provide. My hesitation on why I think this is a better way to his question, get everybody into the exchange, and the competition goes down and providers go really to it. Provided is, I have watched our government, as you know, Medicare and Medicaid, according to Dartmouth University, probably waste about 120 billion a year. I'll get you an exact fact, okay? I think it's approximately, it's in my book, all right? So the efficiency and effectiveness of it, the overhead 3% compared to 12 or 15, 17% according to which private company you're looking at. But when you look at the fraud and the waste and abuse, you then see this cost over here. And so as we argue of how to have a better system, my concern has been from the military. When I priced an aircraft carrier as a 3-star admiral, responsible for all the Navy's $75 billion a year, we did it over 5 years planning, so $350 billion worker program. There was one guy above me that decided if I was right or wrong. An aircraft carrier, we costed it, when I was leaving the Navy, at about $11 billion. One aircraft carrier. The confidence factor we had, working with industry and Office Secretary of Defense, that was the right cost, was about 33%. Mind you, we didn't tell Congress that. We walked across and said, here's your carrier, you want to be safe? Why? Because one place builds ship aircraft carriers. And so once you're into a single payer or a single consumer or a single provider, you get a little bit to your concern of monopolies, etc. By the way, when I got to Congress, I had legislation that said you could not have anything from the military being procured unless they had an 80% confidence factor. It had to be provided. I couldn't get a single co-sponsor for the bill. The United States military in 2006, when I left, over the next 5 years, its estimated cost over one was $350 billion. So when people, I want government to advance our livelihoods, but I want it to be accountable. Okay? Oh, so sorry. First children, now wages. Everybody got that one? But I am not opposed. I mean, I think this can move towards what you want with this all going into one market, where the government sets the standards and enforces them. Women don't pay twice as much as men. Mental health, mind you, mental health parity is in that bill. But we got to watch insurance companies that they don't, like Connecticut has done, begun going over and saying, well, this is how we interpret mental health parity. You really only get 2 visits, not the same numbers if you have a bad kidney. You know what I mean? So those are the fights I'm going to focus on. You're not wrong, but there's also another side, I think, of that, and you guys see how this develops.
So she needs to have her hand up.
I am so sorry.